Minister, many of us as TDs are often contacted by patients or their families about the latest medicine for a specific illness that can transform the life of the patient, and they're looking for approval under the drug reimbursement scheme. This is all part of the rapidly expanding area of healthcare known as personalised medicine. This means that your medical care is based on your own genes and your specific disease. And we know genes are the information that tells cells in your body how to grow and develop. For example, many cancers affect or involve specific genes. And through investment in health research, we can target treatments towards these genes in an approach known as precision medicine. This can be more effective at treating or managing the disease with far fewer side effects than other types of treatment, leading to more successful and quicker recovery, which is far better for the patient and reducing the overall long-term cost on the delivery of our healthcare. This type of precision medicine is built around two key elements. Firstly, technology. Identifying specific genes and how they are expressed through an illness encompasses the whole field of genomics, which plays an important role in the diagnosis and treatment of diseases, including cancers and rare diseases, enabling more efficient and accurate diagnosis and improving treatment selection. Genomics is driving precision medicine to improve clinical outcomes for individuals impacted by illnesses and their families. But we can only use genetic information to develop tests for cancer and other diseases to prevent it if we put the investment into it. Although the government made a commitment in 2020 to develop a national genomics and genetic medicine programme, this key area of healthcare in Ireland lacks clear funding and a structure to deliver this type of innovative technology for patients. The second area, Minister, is people. The days of the doctor examining the patient and then sitting at the end of the bed and outlining a battery of broad treatments that will be administered to the patient in the hope of hitting the right one for that specific illness are thankfully confined to history. Instead, today, the doctor's treatment plan is based on the lab results from an ever-increasing and far more targeted range of tests that can facilitate the precision healthcare that I've just mentioned. But just as technology has become more precise, so too has the importance of the laboratory staff, who are now more likely to be the decision makers when it comes to your treatment, your care, and most importantly, your recovery, than the doctor at the end of the bed. And this is only set to increase in importance. Today, more than 80% of the laboratory medical scientists are educated to master's level, many of them having a second master's degree, PhD, or other professional doctorate. And patients see firsthand how vital the role that they play is, and they've seen it very clearly over the last 2 days of work stoppages. Minister, I had a carer onto me last night. Her procedure where she is in chronic pain was cancelled last January. It was cancelled on 3 further occasions, and she was given a further date this week. Again, it was cancelled because of the industrial action. Now, in this particular instance, this carer has to source an alternative carer on 5 separate occasions so far this year, so that she could actually go and have that procedure. Now, last night, she said to me that she understands the reason why the laboratory staff are taking the action that they're taking. She supports them in actually having fairer pay and career development opportunities. But she also wanted to outline the impact that this is having, not just on her, but on the person that she is providing care for. And as I say, she continues to suffer pain, inconvenience and stress, and has done so over the last 6 months. And the uncertainty that this industrial action is bringing about is making it impossible for her to plan in advance. Now, there is huge frustration out there among medical scientists at the moment. After spending 5 years in college, having professional recognition gained for their qualification, upon graduation, medical scientists actually supervise and are responsible for medical laboratory aids. But bizarrely, their starting pay scale is lower than the people that they're actually supervising. And once medical scientists are registered with Corru, the first reality check that they receive is a pay cut. The second and more depressing hit comes if they do decide to stay for any length of time in the public service. They will work alongside their biochemist colleagues performing the same duties, but will not receive the same pay or career opportunities. Biochemist colleagues with the same qualifications but with less experience operate at consultant level, whereas the senior medical scientists operate at chief medical scientist level, and that is the final level of progression for them. And to add insult to injury, this pay parity anomaly was rectified 20 years ago and then rescinded. Now, Minister, medical scientists stepped up to the plate during the pandemic. They stepped up to the plate during the cyber attack, taking on additional duties, doing additional hours, even though the workforce has been seriously understaffed prior to COVID. And the refusal by the HSE, the Department of Health, the Department of Public Expenditure and Reform to move on these issues has been a clear slap in the face to these particular staff. And Minister, this situation where we have these staff now leaving in droves is a missed opportunity to develop this profession, to develop the whole area of medical science, and to bring about the type of precision healthcare that we need in this country, that ensures that people are given the most appropriate treatment, that they're treated as quickly as possible, that they're discharged back into the community as quickly as possible, or alternatively, that they're treated in their own home or in their own community. Now, the investment in the laboratory services, the investment in laboratory staff is key to achieving these objectives, and it is imperative that we address as a matter of urgency the severe recruitment and retention problem that we have in the service today.